South Africa has adopted the World Health Organization Nurturing Care Framework, a framework which came out of extensive research showing what a child needs, what kind of environment they need for optimal development. The Department of Science and Technology, in cooperation with the National Research Foundation and the Centre of Excellence in Human Development, have partnered in several research projects that have shown how South Africa can adopt the Nurturing Care Framework and how the Nurturing Care Framework actually applies to the South African population. What is nurturing care? Nurturing care is a safe nest, so to speak, for a child to reach their optimal development and to reach their full potential. Nurturing care is a conducive environment, a safe environment. It's an environment where a child is wanted.
Nurture and care is when parents take care of their kids and they look after their kids.
Nurture and care is basically caring for the people that you care about, giving them attention, giving them love.
The Nurturing Care Framework has 5 basic components that talk to the pillars of what a child needs. The first component is good health, and good health applies to both the mother and the child, because the health of the mother will affect the health of the child. It also speaks to adequate nutrition, and again that speaks to the nutrition of the mother as well as the nutrition of the child. And the nutrition of the mother is important even before the mother conceives, because, for example, an obese woman who becomes pregnant is at a high risk of developing gestational diabetes, which can then affect the child. The third pillar is safety and security, and that speaks about the safety of the environment of the mother, the environment that the mother lives in, as well as the environment that the child grows up in. Physical harm, emotional stress, as well as environmental harm such as toxins. The fourth pillar is responsive care. Responsive care talks about the ability of the caregivers to notice the child's signals for hunger or stress or even joy, interpret them correctly, and then respond in an appropriate manner. The final one is opportunities for learning. And learning happens the moment that a child is born. They see their caregiver smiling at them, making certain facial expressions, they manipulate objects around them, their environment. So opportunities for learning are available in whatever environment. Nurturing care is important because of all mammals, human beings are the ones who keep their offspring in their nest for the longest time. You don't find lions with their 18-year-old children in the same pride. So human beings keep their offspring the longest in the nest, so to speak, or in the pride. And so it's very important that the nest is safe, is secure, and it supports optimal development. Nurturing care is important because the cost of doing nothing is very high. Current estimates are that about 205 million children in low-income countries never reach their full potential, and that is sad. And that is not counting the ones that have actually died from early infections because of poor nutrition and poor hygiene. And finally, it's important because every child deserves a fighting chance. The Nurturing Care Framework is most important in the first 3 years of a child's life. And that's because it's funny, we celebrate our birthdays from the day that you're born, but your life actually begins the day that you're conceived. And everything that happens to you from the time of conception matters. Everything that happens in that time period affects your productivity, the way you're able to relate as a social being. It affects your physical and mental health. So it's so important to invest early. The earlier, the better, and it can never be too early.